What is colorectal cancer and how do we prevent it? Colorectal cancer is a type of cancer that affects the colon or rectum. It can begin as a growth, also known as a polyp in the lining of the colon or rectum. Colorectal cancer has the third highest death rate from cancer in the United States. Adults who smoke and drink are more likely to get colorectal cancer. The risk is also higher in adults over 50 years old. There are on average 67 cases out of 100,000 for Americans between the ages of 50 and 54. The rate of Americans with colorectal cancer increases exponentially every 5 years after turning 50. The highest rate of cancer per 100,000 people is among those 85 years and older at 221 per 100,000 people. Per the CDC's cancer statistics, American Indian and Alaska Natives have developed colorectal cancer more than any other race, followed by African Americans, Caucasians, Hispanics, and then Asian Pacific Islanders. Colorectal cancer can also be hereditary. If someone does not eat a well-balanced diet with fruits, vegetables, and organic meat, they will also have a higher risk of getting colorectal cancer. If someone is obese or is overweight, the risk of developing and dying from colorectal cancer is higher. A colon polyp begins with a gene mutation in one of the countless cells lining your colon. These cells divide frequently, and with each division, any mutations can get passed along and accumulate. Over time, mutated cells can form a small cluster. Most polyps are non-cancerous or benign, but they have a chance to become cancerous. If someone has several polyps or they have large polyps, their chances of having colorectal cancer increases. Once someone reaches their late 40s or 50s, has family history of colorectal cancer, or shows symptoms of colorectal cancer, they should get screened by their physician. The physician might then perform a colonoscopy to check for polyps. A colonoscopy is a screening in which a gastroenterologist inserts a camera in the rectum of the patient and examines the lining of the colon and rectum. If the physician finds polyps, depending on the size and frequency, they may decide the patient needs to be screened more frequently. By exercising often, 3 to 5 times a week, eating a well-balanced diet, getting good sleep, and staying away from smoking and alcohol, we can give ourselves a good chance of not getting colorectal cancer. Another way to prevent colorectal cancer is to see a doctor to get screened. One way to find cancer early is to get checked before you begin to have symptoms. This is a good idea, especially if you are at risk. Once someone is diagnosed with colorectal cancer, they have a few options. They can undergo surgery to remove the cancerous polyps or parts of the colon if the tumors are more advanced. Another option is chemotherapy. If the cancer spreads to other parts of the body, said person would more than likely need radiation, ablation, or additional surgeries. Colorectal cancer is a serious disease, but with the right lifestyle choices and regular screenings, it can be prevented or detected early. By maintaining a healthy diet, exercising regularly, avoiding smoking and excessive alcohol consumption, and getting regular checkups, we can significantly reduce the risk of colorectal cancer. Early detection through screenings is crucial, especially for those at higher risk. Remember, taking proactive steps today can lead to a healthier future.